a problem that most people don't want to talk about, but anyone who does have this problem usually wants it to stop.
Yeah, the issue is excessive underarm perspiration or sweating, and it can be pretty uncomfortable, embarrassing, and damaging too.
Sure. Fortunately, though, help is now available. Dr. Scott Carlson is here with us today, along with Sarah Moylan.
Yeah.
Good morning.
This is a problem a lot of people have, not only because they're working out, but it's summertime. Exactly.
Absolutely.
Day-to-day
It's the worst time of the year for it.
Yeah, why is this, that some people seem to sweat more than others or perspire?
It's a genetic thing. It runs in families, and some people are just more prone to sweat more than others.
And now, is this a new technique that has just come available that we're starting to use, or has it been around for a while?
It's been around for a while. It's just becoming more popular as people realize it's safe, and the price point has come down to the point where more people can afford to do this.
Okay, so what are you doing to help people like Sarah that are experiencing this, as we said, sometimes an embarrassing situation?
Well, people who've had this problem, they've failed on antiperspirants and dry saw, which is a prescription drug, and they may even tried some other prescription products, so they will fail on those most likely. So you have to go to Botox, and what Botox does is it actually works on the nerve endings in the armpit to decrease the amount of sweating that occurs.
Okay, so Sarah, you actually had this done about 2 weeks ago, right?
Yep, it's been 2 weeks.
Okay.
In fact, I've read about it. I've always wondered, and I happened to be in his office one day and talking to his staff that runs the aesthetics clinic, and just so happened to be that they were looking for someone to do this segment, and I was absolutely ready to try it because I do have excessive sweating, and I do a lot of fitness competitions. I work out, and that just makes it, I would say, just 10 times worse. And so anything that would help with it, whenever I wear long sleeves, t-shirts, you name it, it's just, it's very uncomfortable, it's embarrassing, and anything that could alleviate it would be great. So
yeah,
sure.
We've heard about Botox for other uses, of course. A lot of times people put it in their face to get rid of those wrinkles that they don't want to have. How was it having it actually done on your arm?
Well, I was a little nervous, and it's funny because I sell injectables for diabetes, so I'm talking about injections every day, and here I am, a little nervous to do it. But in fact, it really didn't hurt at all. It was a little sensitive, when we got to the outer areas, but honestly, it wasn't that bad. I think I had 25 injections in each armpit, so of course I was not looking forward to it, but the pain was very minimal, and afterwards I was fine. I mean, I got right up. It wasn't even like a mosquito bite. I mean, it was easy.
Okay. So you noticed a difference already?
A major difference. It's been 2 weeks. I had a fitness competition this past weekend. I told him that would be the true test because the counteraction with the tan and my excessive sweating usually turns my armpit area green from the chemicals in the tan solution, and none of it. I mean, it was just amazing. And working out, I've noticed that that's an area I'm not perspirating in. It's just been great. So very excited to do it. Hopefully it will get the maximum in terms of how long it lasts, but I'll probably be coming back for more.
Wow, that's wonderful.
Especially if insurance will cover it, which is what he said may be the case too.
Yeah, sure. Wonderful news there too. Now, what are we actually doing by stopping that excessive sweating? We were talking about this earlier. Is that really safe? What does it do? Where does it go instead of?
Yeah, just consider it as sweat glands that are overactive, and you're just toning it down. You're just putting like a governor on it and just slowing the amount of sweat it can produce.
Yeah.
And there's no harmful effects to that.
Wow, that's amazing.
Yeah.
That is big time relief. You said armpits really aren't the only place where you're treating patients.
That's right. We have treated people with excessive sweating on the palms of their hands. You might have seen people who are always wringing their hands and wet. We have an IT person who really gets that and needs help. We can do it on the feet.
Okay, interesting. And you have some really great specials going on right now, Dr. Carlson. Why don't you tell us about them?
Well, right now we're offering some specials for Botox. For example, we have facials and hyperhydrosis for her. About $999 right now. We're taking about $500 off for people who are interested.
Wow, so you're doing it about half price?
Just about, yeah.
Wow.
It's about 50% off. And then for facial Botox, normally we charge about $340 for a full facial for the wrinkles on the forehead and around the eyes and the glabellar area. And we're doing it for $299, so you're saving.
Wow, so those are people that have to call today.
They have to call today and book.
Book the appointment,
Yep.
and then make sure they reserve a spot to be able to take advantage of these really great deals. But this sounds like a really good time of year where people are, you know, they're doing a little bit more sweating because it's been so hot. And it's going to continue that way, Laura, right?
Sure. Yeah, definitely. And I would anticipate this is even a bigger problem maybe in some areas that stay warmer for longer. The southern parts and areas that it's more humid. I mean, we get a couple of really hot, humid days and you notice it right away.
Yes.
We don't deal with it all year long.
Well, I have to say too, for me, regardless of temperature, even if it's cold outside, you know, I'm still sweating.
Yeah,
So-
it's a year-round problem.
Yeah, well, that is fascinating.
Yeah.
That's good. And we have one more other special that we want to mention, too.
That was, we were offering sun damage facial repairs.
Okay.
And the first 20 callers will get a $50 facial, which is an extremely great bargain.
Wow.
It's normally over $120 for that.
Carlson Laser Aesthetics is a place to head in
Call
the summertime, too. Well, thanks, Dr. Carlson. You're always great in making us look and feel our best.
Well,
really
thank you.
appreciate
It's
it.
been fun.
Yeah, thank you.
My pleasure.
We'll be right back.
Are you West?